This is the Fertility Friday podcast, episode number 100. Welcome to the second part of the 100 episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and fertility, and I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. As you know from listening to the podcast, fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles in our work together. If you have recently discovered fertility awareness, but you're not feeling confident about using it for birth control just yet, or if you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. So head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook, where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. Before we delve into today's interview, I'd like to take a moment to thank my sponsor. Today's episode is sponsored by Circle and Bloom. As many of my longtime listeners will know, I have spent a lot of time talking about stress and the negative ways that it impacts the menstrual cycle. And I've also spent a lot of time on the show talking about practical ways to manage stress. In episode 93 of the podcast, I interviewed Joanne Verkuylen, who's the CEO and founder of Circle and Bloom. And in that episode, we spoke about the science-backed evidence behind visualization as a stress reduction tool. Circle and Bloom has developed several programs specifically for women who are trying to conceive. Their natural cycle fertility program, for example, takes you through a 28-day cycle. This program has 28 different visualizations that are targeted and talk about exactly what's happening in your body at the different parts of your cycle. Now, as most of my listeners know, all women do not have a 28-day cycle. Most women actually do not. But the benefits of charting your cycle is that you do know exactly what phase of your cycle that you're in. And with this program, you can target the visualization based on exactly what's happening in your body at that time. And as a special gift to Fertility Friday podcast listeners, Circle and Bloom has offered a 20% discount when you purchase one of their programs. So head over to circlebloom.com/fertilityfriday. circlebloom.com/fertilityfriday. Circle Bloom is one word. And make sure to use the discount code FertilityFriday, again one word, at checkout to redeem your 20% discount. Now let's jump into today's interview. Welcome to part 2 of my special anniversary show. I was so excited to compile all of these clips for you. I had such a great time putting them together and listening to the previous episodes. There was just so much to go through, and it was really just like a great opportunity for me to reminisce. And it was a great opportunity for me to reflect on all the interviews that I've done and the amazing people I've been able to connect with, and also all of the great information that has been shared over the past 100 episodes. And so I've definitely learned so much from you, from my listeners, from my clients, from my guests, and it's just been so much fun. And if you haven't yet listened to part 1 of episode 100, I would definitely suggest to go back and listen to that episode first. So in that episode, I played several clips from some of the episodes that have really touched me and touched my listeners, some of the takeaways that I've had over the past 2.5 years, things that came to the forefront when I was reflecting back on the podcast. And so that's a really great place to start. But I mean, either way, it's not that you have to listen to them in order. If this is the first one you're listening to, that's cool too. But definitely go back and listen to both of them. There's just so many great clips in each of them. And like I said in the first episode, you know, it would be impossible for me to really go through and do clips from every single episode that touched me or every single episode that inspired me, because then I would have probably a week full of episodes. So this is just my compilation. So in part 2 of this episode, I'm again sharing some clips that I wanted to share with you, clips that stood out. And also I have a section towards the end where I just run about 10 or 12 clips, and it's kind of like a compilation of different advice, different suggestions, different myths, kind of like a roundup of what I typically ask my guests towards the end of the show. So it's going to be a great episode. And without further ado, let's just hop right into it. I have to say that the next episode that I'm going to share a few clips with you is one of the most heavily downloaded episodes. So this is episode number 20, the episode that I recorded with Dr. Carrie Hampton. And so in this episode, Dr. Hampton breaks down the fertile window, how to time sex when you're trying to get pregnant, why cervical mucus is essential, why it is the most important part of the equation, and how it can make the difference between whether or not you conceive. And so here she describes fertility awareness and the role of cervical mucus.
Fertility awareness is simply defined as women's ability to identify in their menstrual cycle when they are fertile and when they are not, when they are capable of getting pregnant and when it's not possible to get pregnant. Basically, there are 3 methods of fertility awareness. There's rhythm, which is counting days in the menstrual cycle, and that's not very accurate. And I'd be very happy to come back and talk a little bit more about that. Then there is temperature, which is a retrospective indicator of fertility. So that's often poorly understood by women and health practitioners alike, I have to say. And then the third method is mucus, which is my favorite method because it is the most effective method. You can learn a lot about a woman's fertility through mucus patterns. It's quite extraordinary what you can learn and understand about her fertility, about her health, about why she's not being able to get pregnant, etc. So mucus is a wonderful way of developing an understanding of fertility awareness.
In this next clip from my interview with Dr. Hampton, she talks about the 14-day myth and how trying to conceive on a particular day or around a particular day of your cycle every month can actually reduce your chances of getting pregnant. So again, if this is the first time you're listening to the podcast, or if you've been trying to conceive and you've actually been specifically trying, let's say around day 14 or something like that, this clip will explain to you how doing that could actually prevent you from getting pregnant month after month.
The first thing to say is there is huge variation in menstrual cycle length and fertility patterns within the menstrual cycle from woman to woman. Huge variation. Some women can typically ovulate around about, day 7, 8, 9, 10. Other women who have longer menstrual cycles might not ovulate until around about day 28, 29, 30. So where fertile window falls very much depends upon how long the menstrual cycle is. Typically what I experience in clinical practice is that women come in, say, with shortish cycles, day 26, 27 days long, or longer cycles around about day 36. They're still talking about ovulation around about day 14. And it just doesn't work like that. The shorter the cycle is, typically the earlier ovulation occurs. The longer the cycle is, the later ovulation will occur. Many women don't realize either that it's possible to get pregnant with sex in the menstrual period. Mm-hmm. And for women who have a 26-day cycle or less on a fairly regular basis, they might be fertile during the menstrual period regularly during their period. Women might get away with it for quite some time, having sex during their period, thinking that that's a safe time, and then they won't. And that's, as a nurse working in unplanned pregnancy, that's something that cropped up quite a lot. So women can ovulate quite close to a period, or very soon after the period stops, and they can ovulate sometimes quite close to just before their period starts. So the fertile window can sometimes be as short as a half a day at some point within the menstrual cycle, or it could extend over a couple of weeks long as a woman tries to ovulate many times. So if a woman has a delay in ovulation in her menstrual cycle, she will typically have a long mucus pattern leading into when ovulation eventually occurs. And a woman can only know what goes on within her individual menstrual cycle if she actually tracks her mucus patterns within the menstrual cycle. For instance, if I want to talk about how important this knowledge is when women are trying to get pregnant, I have seen women who have been trying to get pregnant, one woman I can think of in particular, trying to get pregnant for 3.5 years. And it wasn't until she's tracked her menstrual cycle that we were able to identify she only had a half a day of a window of fertility. She only noticed fertile type mucus on a half a day of her entire menstrual cycle. Once she got that organized in her head, in fact, she was pregnant the next cycle, which is quite extraordinary. And she had seen numerous practitioners in traditional health settings as well as alternative health settings, and everyone had kind of given her their advice from their particular perspectives, but no one had actually taught her to understand her individual fertility.
Mm-hmm.
And tracking is important because variability is so huge.
Here in this next clip from my interview with Dr. Hampton, she describes the critically important role of cervical mucus in fertility and conception, to be specific, and she paints a really great picture of what's going on. Again, I love the visual component of that, just to kind of actually imagine what's happening in your uterus, because as women, we're so disconnected from our reproductive organs, and it really stems from this lack of education. The fact that we learn way more about what's going on in our eyes and our ears, which are really important. I'm not saying our eyes and our ears are not important, but I mean, it's so important to understand what's happening in our reproductive system and our reproductive organs. And, you know, for anyone who's ever struggled with whether it's menstrual health issues, painful periods, or any type of reproductive challenge, it just really dials home how important it is for us to have a better image of what's happening in our reproductive organs.
Cervical mucus is fundamental for pregnancy. If cervical mucus is not there, it's not possible to get pregnant. Cervical mucus forms a road system for sperm to get into the cervix and then for it to be capacitated to then travel out or through the uterus and then out into the fallopian tubes where pregnancy occurs. So cervical mucus is amazing stuff. It, as I said, it forms a road system, and it forms a road system by through channels, actually. If you were to look at cervical mucus under a very, very high-powered microscope, you would be able to see around peak time of fertility something like 250, 300 channels. And these channels have negative pressure within them. So as soon as sperm swim out of the seminal fluid and make contact with fertile type mucus, they get sucked into the channels and then directed up into the cervix, where they might have some rest and recreation for several hours or more. And then they get slowly fed out into the fallopian tube. So from one act of intercourse, there could be a steady supply of sperm over 2 or 3 days.
Mm-hmm. And then without cervical mucus, when it's not there, what happens to the sperm?
The sperm don't know where to go. And if the fertile mucus is not there, that means that there is a mucus plug in the cervix. And the mucus plug is a thick, dense cellular plug that prevents sperm from entering the uterus. And at that time in our menstrual cycle, sperm are recognized as being unnecessary. So when ejaculation occurs in the vagina, all sorts of mechanisms come into play to white blood cells come pouring out through the wall of the vagina to gobble up the sperm and clear them away. In addition to that, the pH of the vagina is a little bit lower, and that actually prevents sperm from continuing to live. So either the plug is in place in the cervix or fertile mucus is being released. And of course, the cervix is open during a period. But in between periods, if a woman has a feeling of dryishness or nothingness, that means at the vulva, that means that the plug is in place. If she has a feeling of moistness or wetness, that means fertile mucus is coming through and that she's in the fertile phase and pregnancy is a possibility. So the wonderful thing about mucus is that a woman can get to know her own particular body and know from a day-to-day basis whether she is fertile or whether she is not.
So in this last clip, this is the last clip that I'll share from my interview with Dr. Carrie Hampton. But in this clip, she highlights the research that she's done examining how well women are able to identify their fertile window. And, you know, it's fascinating and also just kind of horrifying to find how many women have been trying to conceive for longer than a year, but are actually unable to identify their fertile window correctly. And to make matters worse, they actually feel quite confident in their ability to identify their fertile window. And based on her research, a lot of women were actually kind of using more of a rhythm method type understanding. So, you know, trying to time sex based on a certain day, even though they thought that they were quite confident that they were trying at the right time.
What I found in that study was that only 13% of women could correctly identify the fertile window of the menstrual cycle, and nearly all of those women had been trying to get pregnant for a year or more. So I'm not sure what the procedures are for you in your country, but here in Australia, once a woman has been trying to get pregnant for 12 months or more, then they can get a referral to IVF. There were only a couple of women in the study who were referred earlier than a year, and they had known medical conditions for which no amount of education would have helped them. So it was important within that study that I learned that many women were applying a rhythm approach. Mm-hmm. A good number of them were doing temperature but misunderstood it. They thought that they were most fertile after the temperature had gone up rather than just before the temperature rise in the menstrual cycle. And women were saying, yes, they understood mucus, but then when they were asked to describe how they were observing it, they couldn't, or they didn't, or they misunderstood it. So 64% knew that they, or believed that they always knew or mostly knew when they were fertile in the menstrual cycle. But when their knowledge was put to the test, only 13% did. In addition to that, we've never really looked at how interested women are in fertility awareness when they're having trouble getting pregnant. But in that study, we did look at that, and we found that 87% had actively tried to improve their knowledge from one or more sources of the information. And the main sources of information for them were the internet, books, and GPs. So why those sources of information are not translating into good knowledge, we don't know. But it might have something to do with just not completing the process of learning about fertility, not having adequate support to integrate information into actual personal knowledge. So you might look up on the internet and get an understanding of mucus, but if you don't have support to document that and understand it correctly, then you're not going to understand it correctly. And a woman needs to document a minimum of 3 menstrual cycles with mucus to have a good understanding of mucus. Theoretical knowledge of temperature is of no help because you actually do need to do it for it to work. So to think that your temperature will go up around about day 14 and so there's no point. That's no help. And, of course, rhythm is not a help either. So, it was very disappointing to see such low levels of knowledge in women who had been trying to get pregnant for 12 months or more and finding themselves at an IVF clinic.
All right. So in the next interview I wanted to share with you, this is from episode number 36 with Laura Werschler. And in this clip, she describes the disconnect between the care that women actually want from their physicians. So what they want when we, what we all want when we go to our doctor versus the care that we actually receive a lot of the time, not all the time, but a lot of the time. And the analogy that I use, unfortunately, is that you wouldn't go to McDonald's and order a steak because you would know what is on the menu at McDonald's. And so you wouldn't expect something different. And, I believe that it's important to know exactly what services your doctor is offering, understanding the perspective that your doctor is coming from, and recognizing that your doctor may not be the best resource when it comes to your menstrual health and fertility, especially if you're looking at a more natural or alternative approach. Not to say that, your doctor isn't necessary, because absolutely we all need to go to the doctor for certain things, and there's certain testing, especially when it is related to fertility, that you can only really access through your medical doctor. But it's important to know what to expect. And so I'll let Laura Werschler talk a little bit more about that.
I think that it's the difference between thinking that providing hormonal birth control is providing a health service, which really it's not, other than helping a woman prevent pregnancy if that's what she's choosing to do. But by supporting a woman in not using hormonal birth control, you're supporting her desire to live in a healthy way, in a way that supports her well-being. So I think doctors don't know actually how fertility awareness works. I don't think they understand the scientific foundational knowledge of how the menstrual cycle works. They certainly don't have any clue that the menstrual cycle serves any function other than reproduction. They don't understand how healthy, consistent ovulation is a healthy process, and that it's inconsistent ovulation that causes women's problems, not incessant menstruation, as they like to say. I think so. They act out of ignorance. They act out of this patriarchal view of medicine as being the one to protect women from themselves and their own bad judgment. It's patriarchal. It's condescending. It's like two separate things trying to operate in the same realm. And basically, that's why I am so encouraged by what I see, which is all sorts of young women saying, hey, I don't need my doctor to give me what I need here. In fact, I've pretty much figured out she's not going to give it to me. But let me see. There's all these paramedical professionals, naturopathic doctors, nutritionists, holistic reproductive health providers, doulas and midwives who are learning about supporting non-hormonal methods of contraception. I can go to them to get this information. I don't need to go to my doctor. So that encourages me, because basically what I see happening is young women saying, I'm not taking your drugs. I don't want your IUD inside of me. I can take care of this. I want to be mindful about my sexuality and my pregnancy prevention strategies. And I figured out that there's somebody over here who's going to serve the need that I have. You're not going to serve it. Guess what? I'm going to find somebody who can. And the beauty of it is more and more and more, there is someone who can meet that need. And so we've got this dichotomy developing of women who don't want to use hormonal drug or device-based contraception. They're off finding support in other places. And women who are perfectly comfortable or don't understand or realize that maybe they've got a problem with some of these other methods, or that there are options, are happy to work with the physicians.
So if you're a longtime listener of the podcast, or you've listened to, several episodes by now, you'll know that one of the themes that has run through the past 99 episodes is the idea that a woman's menstrual cycle is the fifth vital sign of her overall health. If a woman's menstrual cycle is off, then it's kind of the same idea as if your check engine light is on in your car, or if your smoke detector starts beeping in your house, it's telling you that something bigger is going on. And if a woman's menstrual cycle is consistently falling outside of normal healthy parameters, it's telling her something about the larger state of her overall health. And since recording my interview with Dr. Thomas Cowan, I have referred to this clip over and over again because it really drives home how integral a woman's reproductive health is to her overall health. And he doesn't mince words. I just love the bluntness and just the lack of hesitation at how important he describes infertility and its relation to a woman's health. What would you say is the biggest myth about fertility that you would like to see corrected?
Well, I guess that, I don't know if it's a myth, because I don't know if anybody believes it, but if somebody has infertility, they're not healthy. And it could be a personal thing, meaning you're not healthy, or it could be because there's, women, everybody now has all kind of extra estrogens in their tissue from all the poisoning and pollution in our environment, men and women. And so the idea that, you're perfectly fine, you're just infertile, that's nonsense. If you're infertile, you're not fine. So if you're infertile, you need to do something to get yourself to be healthier. By definition, the idea that there's nothing wrong with you is, it's amazing. It's like going to a doctor and you say, I can't have a bowel movement. And he says, that's fine. Some people have bowel movements, some people don't. It's not true.
So yes, that clip was from episode number 70. And, Dr. Thomas Cowan, he really gets the connection between fertility and health and really calls into question why we've started to think that having fertility problems are normal and not really considering that being a healthy, fertile person is and should be just considered a normal, healthy part of life. And then if we're not fertile, that we should really be looking at our health in a broader way and not just thinking it's normal. And in one of the more recent episodes that I released, I had my guest, Dr. Susan Rako, on the show. And we tackled the idea of menstrual suppression and the impact of using hormonal contraceptives to suppress menstruation. So this was episode number 95, and it was a really hard-hitting episode for my listeners. I received so much feedback, so many comments. I received emails. And, a big part of why that episode hit a lot of listeners, a lot of women so hard is the link that Dr. Rako exposed in her book between long-term hormonal contraceptive use, HPV, and cervical cancer.
Well, I was very disturbed to find when Seasonal was released how poorly it had been researched. It had been tried on really a very, very small sampling of women. And I'd have to go look in my book to find the exact numbers again. But a very small sampling of women. The idea that even young women, teenagers, are being encouraged, some sports people, because it's not convenient to have your periods if you do sports or whatever, that for convenience, that it's essentially an experiment on the long-range effects of nonstop birth control use.
Well, and an experiment because those long-range tests
they won't know until it's happened, right? Actually, it's only because of some data that was collected in England where, because of the National Health Service, records are kept really well, and they can go back and look over what happened 25 years ago because they have records like this, that I discovered a paper that showed just statistically what was the cause of death in women over a 25-year period, women who had ever taken the birth control pill, compared with a very large cohort. It was 25,000 women, I believe, an equal number of women who had never taken the birth control pill, comparing mortality, causes of death. And it was this that really put me on to the information that I present later in the book about the link between human papillomavirus, long-term birth control use, and cervical cancer. because looking at the data, we could see, and this is a retrospective, you could say it was a retrospective experiment. These women weren't chosen at the beginning. This group will take birth control pills and this group won't, but because they have such good records in England with the health service, they could get the information, so make use of it at least. And when I looked at the mortality, I wasn't surprised to see the increased numbers of women who died of thrombotic, of clots and stroke, because everybody knows, or we should know, that estrogen is a risk factor for clotting and that the progestins in birth control pills contribute to deep venous thrombosis and stroke and pulmonary embolism, which is a very severe thing that young women can die from. So I saw all of that, but I also saw that a very large percentage increase in women dying of cancer of the cervix. And that was a shock to me. I didn't really get it. And at the same time, information was coming out that it had been pretty well discovered that the human papillomavirus causes cervical cancer. 97% of cervical cancers are caused by high-risk strains of human papillomavirus, HPV, that there's now a vaccine for young women. But anyway, I'm going on and on and on about this. Is this something you'd like to continue the discussion about?
Well, absolutely. That was your discussion of HPV and cancer was a particularly important and interesting one. And it's disturbing for a number of reasons. So there was an excerpt of your book then that I had put in my notes here. And basically you said it. Or no, here, I'll just read a part of it. What was news to me was the alarming number of women who used the pill and had died from cancer of the cervix. That risk appeared to increase over time. The longer that women used oral contraceptives, the more of them died of cervical cancer compared with women who had never used the pill. And now what I found most disturbing about, this whole discussion around HPV and cancer and the pill was that you said in your book that you thought that it was because of, HPV is linked to cancer. So you kind of thought that it's because women on the pill aren't using protection. So if you're on the pill, you're not using condoms. Therefore, you're exposing yourself more to HPV. And that would be the reason why there's a higher rate of cancer. But that's not what you found. So no, I'd love to hear you talk about that.
You really have it down so well. Tell me what you got out of the next part of what I wrote. I mean, I certainly can talk about it, but I'd like to hear it from you. It's very exciting for me to hear back what I wrote.
Well, I've talked about on the show how the pill negatively impacts, for example, a woman's gut health. And we all know that gut health is related to immune health, or at least many of us are starting to learn that. But what I've discovered from reading that section of your book was that it's not that women are contracting HPV more and getting cervical cancer more because they are being exposed to more virus. When you researched, you cited a study that was done, and essentially the women in the study, neither were using condoms. So you have women who are not using condoms and they're not on the birth control pill or any type of hormonal contraceptive. And then you have women who are not using condoms and they're on hormonal contraceptives.
Right.
But the women who are on hormonal contraceptives are getting the HPV. So basically, women who are normal and healthy then have a degree of protection. We have immune systems.
True.
And
That's
so we're
true.
not just going to get the HPV, but then the pill makes us more susceptible to actually contract HPV.
Mm-hmm.
Oh my
goodness. The pill is a co-carcinogen. It works along with the human papillomavirus. It makes the cells of the cervix more vulnerable. Women don't fight it off as well. There are several ways that I can understand that, and there are probably reasons I don't know yet. But for example, being on the pill reduces the amount of free testosterone, but it also reduces the amount of ACTH, which is the adrenal corticotropic hormone. And so we don't have the same immune system responses. And that's a fact. I mean, certainly everybody who's ever had a period knows that there are various times of the month when you tend to catch a cold more often than other times. Our immune system is very responsive to the levels of hormones that we have. And it's affected through the cycle. I mean, I think the times I used to tend to get sick were around my period. That would be when the progestin was the first highest and then dropped off. But in a normal menstrual cycle, for a significant part of the month, we have our full boost of immune system responses. But on the pill, that's muted. And probably not only HPV, but lots of other things as well. But HPV for sure. The pill is a co-carcinogen along with the human papillomavirus in causing cancer of the cervix.
Dr. Reiko's research highlights the way that hormonal contraceptives depress immune function. And one of the ways that hormonal contraceptives impair immune function is by disrupting a woman's gut flora. And so I would definitely, if you haven't had a chance to listen to episode number 95 with Dr. Reiko, definitely take a listen, because it just really highlights why menstruation is actually important for a woman's health, regardless of whether or not she ever wants children. And it also highlights some of the, key problems with hormonal contraceptive use. But going back to gut flora and the relationship between a woman's gut health and her fertility, in my interview with Dr. Daniel Kalish, he spoke about the connection between gut health and fertility challenges in this next clip. My interview with Dr. Kalish was episode number 84. What factors are necessary then for a woman to have a healthy menstrual cycle?
So three big variables really is probably the easiest way to look at it. Figuring out how you're going to address the stress, whether it's exercising better, eating better, figuring out, more free time, whatever it is, better sleep quality, dealing with the stress component. That's going to calm down your brain. And then second is making sure your digestion is working really well, because that's sort of the hidden generator of inflammation most of the time that's disrupting hormones. I know it seems strange, but it's just what we see with these labs. Most common pattern is some kind of odd gut infection or some food reaction or something that's inflaming the gut that's throwing the hormones off. And then the third variable, and it's kind of in a way a more interesting topic, but probably not quite as important, is making sure that you're staying away from as much as you can or getting rid of environmental toxins that can act as hormone disruptors. That's pretty important. So those are the three big ones. Those are the three big issues, probably.
Okay, and could we delve into just a little bit deeper the gut connection? Why is there such a strong connection between the gut and then your hormones?
Yeah, so when the digestive tract is inflamed, you make a lot of anti-inflammatory responses, and one of the main anti-inflammatory hormones is cortisol. So right away, you've got this hormonal reaction as your body's trying to deal with inflammation. Cortisol goes up. Then the next thing that happens is the thyroid hormone levels drop, and then progesterone and estrogen drop. And testosterone drops as well for men and women. So the more inflamed you are, basically, the more messed up your cortisol, thyroid, progesterone, estrogen, and testosterone are. So it doesn't matter where the inflammation is coming from. And we tend to, just because the way we live and current culture, generate the bulk of our inflammation in the gut. And that has to do with, choosing foods that are pro-inflammatory, not eating anti-inflammatory foods. That's code word for vegetables and fruit. Not, alcohol, obviously really pro-inflammatory. And then this is the strangest one. It's going to probably freak people out the most when they hear this, but half the women that we test have chronic digestive tract infections. Microscopic bugs in their gut, whether it's bacteria or yeast or parasitic overgrowth. And those little bugs in the gut cause a lot of inflammation and a lot of digestive tract problems that will tie up the hormones as quickly as eating the wrong foods will.
So yes, my interview with Dr. Kalish is episode number 84, and it's just a great interview to listen to, especially if you've had any fertility challenges. He talks about his approach, the Kalish method, and basically the things that he crosses off the list to help his patients really get to the root of the problem and figure out what is standing in between them and their fertility. And again, still addressing gut health. Of course, I wouldn't be able to do that without playing you a clip from the interview that I did with Dr. Natasha Campbell McBride. And so in that interview, that was episode number 66, we delved even deeper into gut health and the connection between gut health and fertility, and even beyond that, to how a mother's gut health impacts the overall health of her children, years later down the line for years to come. And so in this clip, I asked Dr. Natasha to talk about one of the main factors that drives women back on hormonal contraceptives, which is acne. So a lot of women, went on it to begin with for acne, for breakouts, and then they go off of it and the breakouts come back. And it's like a totally not cool, frustrating to be, say, 30 or 35 or 40 and to have pimples like a teenager. So unfortunately, it drives a lot of women right back on the pill. And so I asked Dr. Natasha how gut health is related to acne. So here's what she has to say about that.
What people have to understand that your face is the mirror of your bowel. Whatever's going on in your bowel will be right there on your face. Chinese have made this postulate 2,000 years ago, or maybe even longer. And with our modern tools, whatever we can study with our modern tools, we absolutely confirmed their finding. So if you have acne, your bowel is rotting. You have a rotting bowel in there. There's a lot of toxicity being produced there, and that's what's showing up on your face. Clean up your bowel. With GAPS nutritional protocol, part of it is enemas and colonic irrigation. There's a whole chapter there on constipation and what to do there. So clean up your bowel. Make no mistake, more than 90% of anything toxic floating in your blood and causing symptoms in your body, not only acne, but many, many other symptoms, your mood swings and your depression and your poor sleep maybe, or many other symptoms, comes out of your bowel. Once you get it clean, once you clean it up, all of those symptoms will disappear, as well as acne, and populate it with the beneficial flora. And your acne will disappear in a much better way than what the contraceptives will do for you. Again, all the contraceptives do, they just mask the whole situation. You add another toxin into the body on top of that river of toxicity that's already flowing from your bowel and being distributed around your body. You think your body has no limits? It will come out some way. It will show itself maybe later on, maybe not this year, maybe not next year. But maybe in 10 years, you would be thinking, where did this cancer come from? Or where did this rheumatoid arthritis come from? Or where did this lupus come from? Or something else. From all of those things that you've been doing to yourself. So it is time to start subtracting toxins, not adding them.
As only Dr. Natasha can relate, a very blunt and powerful message about gut health. Now, although I talk a lot about Western medicine in the show and how it often fails in terms of meeting the needs of women's health and fertility, reproductive health, in my interview with Dr. Danielle Miller, now Dr. Danielle Miller is a NAPRO physician. And so this is episode number 31. If you've never heard of NAPRO technology, it's basically a medical application of fertility awareness. This is an evidence-based, research-based model of care that uses a woman's menstrual cycle chart specifically as an actual literal diagnostic tool to identify underlying pathologies, whether that is related to low hormone levels or other reproductive challenges, whether it's the amount of mucus a woman has on certain days, whether she has mucus on certain days or she doesn't. These things play a huge role then from a NAPRO technology perspective on how they observe and identify what could be happening in her cycle. And, it goes on beyond the chart to testing at certain times of the cycle, making sure that if you're testing for her luteinizing hormone level, you're doing it on the right day, making sure that if you're testing for her progesterone levels, that you're doing it in the right phase of her cycle. So it's a quite literal marriage of Western medicine and fertility awareness cycle charting. And so in this clip, Dr. Miller gives us a really good idea of what NAPRO technology is and how it utilizes the information gathered from a woman's menstrual cycle chart.
I would say the general approach towards women's health is not to identify the underlying problem and restore normal function, okay? This is how all the rest of medicine is, except women's health, okay? So I just want to give a quick example because it might, maybe it will drive the point home. And then I'll talk about how NAPRO works. If somebody presented to the ER and simply said, I had chest pain, and they went and got bypass surgery, and that was it. They said they had chest pain and then got bypass surgery. That might not really be a good idea, okay? Let's say that the cause of their chest pain was pneumonia or a rib fracture or gastroesophageal reflux or a stomach ulcer. You know, I mean, the sort of, you know, this is not something that we do in any other area of medicine except women's health. You know, when a woman presents with an abnormal cycle of any kind or a cycle-related problem such as pain or PMS or whatever it is, she's offered a hormone suppressive therapy. Or if a woman presents with infertility, she's often offered little or no workup and then an IUI, intrauterine insemination, or IVF, in vitro fertilization approach. But we don't actually find out why the woman is having menstrual pain, long irregular cycles, infertility. We don't give women the answers they seek. So I just want to say that it's only acceptable in women's health for the medical community to ignore all the differential diagnosis options, to ignore all the workup, and to give a one-size-fits-all treatment approach to most every patient we meet. And I just think that's really not the right thing to do.
I couldn't agree more.
So I just want to say that that's the difference between NAPRO technology and sort of the mainstream approach towards women's health, which is really a sad thing to say that women are stuck in this place of not being treated like adequate patients in regards to their reproductive bodies. So how does NAPRO work? I would say that we tend to treat women's health like we do all the rest of medicine. We really focus on taking a really good history, doing a really good physical, and then we have the wonderful advantage of having a patient who is charting, which is just delightful and allows us to do a lot more than when she's not charting. Most patients are actually charting Creighton. Maybe their practitioner referred them, or they have self-referred and wanted an approach like this for their gynecologic or infertility problem or other. But sometimes I will encounter a patient who is using a different charting system, and she's happy to explain to me the details of her chart that I'm not familiar with, and we can do our best that way. So once we have the tools of the patient telling us all about what brings her or the couple in, and we do a physical, and we've got this great chart, which is such a wonderful resource in front of us, then we can actually do a really focused workup, okay, which is exciting for both the patient and the doctor because we can actually find out what's going on. So workup generally includes things like labs and ultrasound. And it really depends on the problem in terms of what kinds of labs and ultrasound are needed. I guess maybe using an example might help. So it's easy to sort of use the example of infertility. Infertility is a symptom of one or more underlying problems. It is not actually a diagnosis in and of itself if you really think about it. Sometimes women are offered a day 21 progesterone level when they have an infertility problem. I don't know if you or your listeners have ever heard of that. Mm-hmm. It is meant to capture a peak or a very high progesterone level about a week after ovulation. That's the goal of it. However, if any of your listeners chart or have ever known anyone that's charted, she might know that women don't ovulate on day 14, some or all of the time. And so trying to capture this high peak progesterone level on a random calendar day may not actually represent anything medically useful at all. It also doesn't give you an idea of her whole luteal or post-ovulation phase. You can have progesterone deficiency before or after a peak day with a normal peak level. even if you happen to guess the right day, which would be kind of unusual. And so, that's sort of the lab approach might include capturing one female reproductive hormone on one day of the month, not timed to her cycle, which is pretty sad. Laboratory approach through NAPRO would be frequent labs during the fertile phase, looking at estrogen, because that's what's going to rise and fall around the time of ovulation. And also looking at a series of hormone labs after ovulation, both estrogen and progesterone, because each should have its own specific curve where it rises and falls. And there are different hormone abnormalities that exist in multiple ways, both during the time near ovulation and the time after ovulation. And so we take a targeted hormone approach and we obtain a hormone profile. And women, they have a few blood draws in the month. They might have perhaps around 10 plus minus total blood draws for the month. And of course, that's a lot. But women are generally really looking for answers, and they're okay finding out the answers to their underlying problem. And I guess ultrasound is very similar. Some women will be offered one ultrasound some of the time if they're having infertility or another problem. But if we're looking at an issue like infertility, it's not just what her reproductive organs look like on one day of her cycle, but yes, we want to know baseline what do her organs look like, but a NAPRO physician is interested in ovulation. And is ovulation occurring at all? Is ovulation occurring normally? So NAPRO technology has identified several different ovulation disorders which are not going to be captured on a one-time ultrasound. You actually have to follow a woman through the time where a few different follicles start to develop. One is going to chosen to be the dominant follicle for that month, and then it should rupture in a normal way, and the ovary should have a normal appearance after rupture. But you can really identify some serious issues if you do more than one ultrasound for the month and really focus on that follicle and that ovulation. So that would be the difference with the approach in terms of workup. And then the problems are usually identified, which is the whole point. And then if you know what's wrong, then you can use different medical and or surgical therapies to treat someone who may have an abnormality.
As you can imagine, by the end of that episode, so like I said, if you have not listened to episode number 31, definitely take a listen, download it for later, for tomorrow's drive to work or something. By the end of that episode, you'll be scratching your head and wondering why this isn't just how women are treated, why this isn't just the standard of care for women, all women who are facing fertility challenges. When you hear about the ways that charting can inform diagnostic testing to, ensure that these hormone levels are being accurately measured and ultrasounds are being done at the correct time of the cycle, it's just terrifying to me that it's not done this way. And I can't, tell you how many women are told that they have low progesterone or low FSH, follicle stimulating hormone, when in reality those tests weren't even done on the right time, at the right time of the cycle. If doctors are still ordering tests on a particular day, so saying that, we need to order this test on day 21 of your cycle, or we need to order this test on day 14 of your cycle. I mean, this type of thinking is assuming that all women ovulate on day 14. And for any woman who's been charting her cycles for any length of time can attest that nothing just happens on the same day every single month, every single time. There's a ton of variations there. And so this really gets at the essence of the podcast. It's a lot of information to take in. If this is the very first episode that you're listening to, here I am trying to put all the mind-blowing stuff in one place. So rest assured, I absolutely could not capture every single moment that I would have loved to on this episode. Those episodes that I shared with you, I really wanted to just showcase some of the key kind of learnings, the key mindset shifts, some of those key pieces of information that can really impact your cycle, impact your life, impact your perspective on how your body works in your fertility, and just give you more to work with than just like some doctor telling you that you're infertile, giving you different options to look into, giving you information that you need to then go and make informed choices, or even just giving you resources so that you can take the incentive to learn more. One of the things that I think I might do an episode just of, my own takeaways for the past 2 years of doing this podcast, because there are so many. And one of the ones that I've been speaking a lot to my clients about is just that idea that nobody cares more about your cycle, your reproductive health, your fertility, your ability to have children than you do. And it's really, the way I look at it, doctors have a place at the table, but ultimately you should kind of consider healthcare and other resources, other supportive practitioners in your life as members of your team. So you get to choose who's on your team, but there's not one person on your team that necessarily gets the final say. You're the one that gets the final say. So if you think about it as having kind of a round table of your health professionals, each person has an important role to play. And they can put forth their suggestions and their information. But ultimately, we have to kind of take that power back ourselves to make the decisions of what is going to be best for me. And not just to get rid of the symptom. What I hear from women so much of the time is, my doctor just told me I should just do this. You go there with a problem and they just want to fix it. They just want to give you a quick solution. But you're left wondering, well, why do I have this problem in the first place? I shouldn't be having the problem. I don't have an Advil deficiency. If I have painful periods, it's not like I'm deficient in Advil. And if I have irregular cycles, it's not like I have a hormonal contraceptive deficiency. That's not what's causing my cycles to be abnormal. And so as women, we want to know the answers. Like, what is wrong? Why don't I have the healthy cycle that I've read about? And so I hope that the clips that I've been sharing with you kind of shed a little bit of light on that. And as my long-term listeners know, I typically end each podcast by asking similar questions. I don't always ask the exact same questions, but I do ask similar questions. And I often ask my guests to share advice for women who are struggling with menstrual cycle irregularities or fertility challenges. And, I also ask about things that women can do if they're thinking about pregnancy. I typically ask about the myths around fertility that they, have heard and that have impacted them. And so in this next segment, I am just going to play for you some clips with just some great tidbits of information that my guests have shared over the past 99 episodes, now 100. And so here are 17 short clips. So I'm just going to play them back to back. As I mentioned, I am going to have a list of all of these clips on the website, on the show notes page, which you'll find at fertilityfriday.com/100. And so if you're wondering what a particular clip is, or which episode is from where, I'll just have them all listed in order. And so here is some great advice and information from 17 of my past guests. What would you say is the biggest myth about fertility that you would like to see corrected?
Oh, okay. I would say that proper thyroid function is essential for a healthy menstrual cycle, and that most menstrual cycle dysfunction is related to unhealthy thyroid function. And that's a complicated thing. But if you think you have a funky cycle, that's the first thing you look at and read about it. And get some professional help.
What would you say if you had to pick one? What is the biggest myth about fertility that you'd like to see corrected?
The biggest myth about fertility? What the first thing that pops into my mind is women who say, oh, I'm just super fertile. That method will never work for me. Or, my grandma did that and she has 7 kids. Or the science, this is directly related to contraception. And I know that's just one little piece of it. But the lack of scientific backup in so many stories is appalling. That if you look at the science and see that we are only fertile for this certain number of days each cycle, and the fact that women don't get that they're taking a pill every day of their cycle. They're treating every day equally as if they're all risky days for conceiving, that drives me crazy.
So, Katie, what would you say is one of the biggest myths about fertility that if you could wave a magic wand and erase it, that you would get rid of altogether?
I don't know that there's anything I would erase as much as encouraging a return to an orientation by cycles. And there's so much, again, because of technology, like we can have our houses at 71 degrees, every day of the year now without too much effort. And so we don't, seasons are kind of different. I mean, we can have strawberries all seasons of the years, apple all seasons. Yeah, that's kind of confusing that we have so much available to us in all seasons 24/7. And I guess my wish would be for a return to an appreciation of seasonal changes, cyclical changes, that there are cycles of fertility and cycles of infertility, and that's healthy. We all have limitations.
Is there any one thing that you think all women should know about the fertility awareness method?
Ooh, one thing. It's not just for having babies or birth control.
Mm-hmm.
It's for knowing your feminine self in a way that can really rock your world.
Beautifully said. I love that. What would you say is one of the most common myths about fertility or fertility awareness that you would like to see corrected?
Oh, that fertility is not just for having babies. The word fertility, and I ask my students and clients this in every class, what's the first thing you think of when I say fertility? Everyone says babies. And I want the whole world to know that the term fertility is actually so much more than that. It's for women who never want to have children ever, or women who are on birth control and don't care about their fertility. Like, it's for everyone, because a woman's fertility is her vibrance. It's her connection to a greater orchestrated process that's happening in her body. And women who and men who like take time to kind of learn about a woman's fertility are just learning some of the most essential things, I think, of Mother Earth. And so it's beautiful. Fertility is something that everyone should kind of embrace and learn at much younger ages than we do now.
And so for any of our listeners who are currently on the pill, and maybe they're listening to this podcast because they're thinking about coming off and they're trying to kind of gather more information about fertility awareness, they don't want children right now, but they do want them someday, and they, maybe within the next 2 to 3 years, what advice, if any, would you give to them?
Well, one of the things that I like to tell women who are kind of in that contemplative stage of things is that you can actually start to chart while you're still on the pill. And I think that that's actually a great thing to do if you're sort of on the fence or feeling nervous, because it gives you an opportunity just to really hone the skills of the checking, the charting, like all of that, so that if and when you decide you are ready to come off the pill, then you have one less thing to worry about, right? So there are many stages to mastering fertility awareness, and one of them is really just getting in the habit of checking for mucus every day. And just like changing our diet or exercising, it takes a while to change a habit. And for most of my clients, the first few weeks maybe even of charting, they'll go to the washroom and sit down, and then they'll be, oh, I forgot to check, So it takes a while just to develop those skills, and so it can be nice to kind of get those under your belt so that when you come off, it's one less thing to worry about. And then you also, you kind of get to taste what it's all about before making a commitment to it. So that's something I would definitely recommend. I mean, obviously, you're not going to see a real cycle because women are not ovulating when they're on the pill. But as I said, there's so many skills that you can, develop and hone before deciding whether or not to come off the pill. And I think that's a great way to kind of build confidence and understand how your body works before making that leap.
What would you say is the most common myth or misconception about fertility that you would like to see corrected?
I think for me at the moment, I'm thinking a lot about how people assume that when you come off the pill, you immediately become fertile and that you can get pregnant right away. And for some people, that's true, but for many people, it's not. I think that it would be really great to see more support in that area when women come off the pill, whether they want to have a child or not. Discussion about how long it takes them to get their cycle back. Because we're told most commonly that it should be within the month or within 2 months. And often it can be several months or even a year. And I've known many, many women that it's been over a year. Some that it's been several years. And because of what we were talking about before, this idea that having a period isn't healthy anyway, you have a lot of women who don't even really know how to seek help or advice for that, because it's not something that we've been told is something to be worried about. You don't have a period? Great, why aren't you happy about it? So I think I think we need a lot more support in that area and a lot more information for women so that when they come off the pill, they know what to expect and they know how to have a better transition, really, overall.
And for a woman who is currently on the pill, she doesn't want to get pregnant right now, but maybe in the next few years she wants to start thinking about having a baby. What advice, if any, would you give to her?
Oh, I've already had to give this advice to many because I'm 32. So this is all people talk about. It's just not stop taking the pill as soon as you can, and then start dealing with whatever problems you might have. And you might not have any problems, but you might find you have PCOS, or you might find you have endometriosis, or you might find that your body has to start the maturation process again because you've been on the pill since you were 14. And it's just better to start now than to try and wait for the 3 years, think, oh, okay, this is the year I'm having my baby, and then realize you're going to have to wait another 3 years. Mm-hmm. Do that. Learn fertility awareness. Get some good Japanese condoms until you're ready, and then you'll be ready, and so will your body. I think that's the best way to go about it. Even if you're, because people do leave it and then they say, oh, I can come off when I'm 36, and then that can be heartbreaking to someone who really wants a child and then finds that they have to deal with this mess of health issues, or have to end up being into IVF, which is really bad for you and horribly expensive.
The biggest myth, I would say, is probably that, this is what I think is one of the biggest problems, is that if it takes a woman a little bit of time to conceive, that she must go through, a fertility clinic and medicated cycles and IVF. I think that there are instances where that is necessary, but I think that there's a lot of times when we almost feel that that's our only chance to get pregnant is to go there to the fertility clinic, and sometimes that can put a lot more stress on us in every way. So the whole process is stressful. In many patients, it's not really the only answer, and I can say I've seen just hundreds of patients who've done these types of medicated cycles, and they haven't worked, and then they've tried natural and they've been able to conceive. So I think that it's always good to remain open and do an investigation before going to that level. Although I refer my patients there, absolutely, there are many patients who need those treatments, but I wish almost that we could do integrative fertility first before patients would go through the more intense cycles. But again, I work with a lot of fertility doctors, and they do work miracles in many cases. So it's something that I think it's an amazing thing we have access to these days. But at the same time, when we can work on these underlying issues from an integrative approach, even if a patient does need to go that route, it will work. It'll have a much better outcome because we'll have improved egg quality and overall health as well.
I always like to remind my clients that when you're considering getting pregnant, whether that's you're trying to get pregnant yesterday or if you're thinking about getting pregnant in the next couple of months or maybe the next year or so, the amount of nutrients that you have stored in your body up to a year before pregnancy can affect the outcome of your pregnancy. So now I'm not saying you're going to necessarily be at risk for miscarriage or things like neural tube defects, which are serious issues, but even just making sure that your child is neurologically as developed as is possible, limiting the risk of certain issues like autism or other things that can come from methylation defects, making sure that your child isn't at higher risk for obesity or other chronic diseases like heart disease. I mean, it's amazing how much the nutrition of the mother can actually affect the child's long-term health outcomes. So again, I'm not trying to say this as a scare tactic. I just like all my female clients to know that your diet a year from before you even conceive your child is going to affect how much nutrition your child is able to extract from your stores. So if having children in the next year or two, or even in the future in general, if that's something that's on your radar, it's always good to get started on this as soon as possible, even if you're still on birth control. If somebody wants to do it from a food perspective, the 1/4 pound of liver per week is essentially the number one thing I could recommend as far as getting your nutrient status up to where it needs to be.
And what would you say is the biggest myth about fertility that you would like to see corrected?
Wow. Oh my goodness. That's a big one right there. The thing that comes up to my mind first is just the trouble with birth control pills. And I know you've done shows about this for sure. But I had a conversation. Actually, she wrote the foreword for my book, which is just crazy that I'm even able to say this. So Dr. Sarah Gottfried, who wrote, yeah. So the New York Times bestselling books, The Hormone Cure, The Hormone Reset Diet. So she wrote the foreword for my book. And she said that the number one, she didn't even hesitate, most damaging thing to women's hormones is birth control pills. And this is coming from a Harvard-trained, MIT-trained physician who's worked with, countless. Just like it's crazy how many women she's worked face-to-face with. And that's the one thing she threw out there. So I think that one of the biggest myths and / mistakes is buying into any form of birth control as a treatment, especially for young girls who probably aren't even having sex, to regulate their cycle. I really want to point people back to the fact of generally when that is happening, when your cycle is becoming abnormal, it's your body's giving you feedback that you need to change something. And we don't want to suppress that. We also don't want to suppress those natural rhythms because it can cause problems down the line by taking on birth control pills as a form of not getting pregnant for the hopes that I'm going to get pregnant someday when I'm ready. There are far better options out there and things that are going to contribute to your ability to conceive once you're ready for that.
What would you say is the biggest myth about fertility that you'd like to see corrected?
That's a good question. Well, I guess that folic acid is good for you. I don't know. I don't hear a lot of fertility myths out here in California. People out here are pretty straightforward.
That is a great one, I have to say. And you were the first person to say that. And it's so true.
Yes, I would have to say the folic acid piece about everyone, all the doctors pushing folic acid on women who might have the mutation and don't know it, and especially if they've had multiple miscarriages or children with birth defects.
Yeah, exactly. I mean, I remember the same thing going through high school, that to prevent unwanted pregnancies, you take these certain steps, but no one actually tells you, well, actually, there is a finite amount of time when you are fertile. So, I think that's a really important message. And I think, being in my 20s, I was surrounded by a lot of clinicians and reproductive scientists that from that stage were telling me, no, you've got to have an idea about when you want to start a family, regardless of whether you have a partner or not, because, there is such thing as too late. So I think, I was very fortunate to have that because of the environment that I was studying in, but I think that needs to be more commonplace to the general population.
What would you say is the biggest myth about fertility that you would like to see corrected?
The first is that you cannot have an impact on the health of your eggs. That's something that I've seen over and over again over the past almost 10 years now, actually. I have to update my bio. We've been working with clients is that you can. Of course, not every single person is it going to work for, but a lot of people will have done an IVF cycle. They can see the state of their eggs. They make these changes over at least a 3-month period of time. They go back in and they had so many more follicles. They had such better health of their eggs because they're actually looking at these through a microscope. They're seeing the difference in their blood work. So that's one. You can have a difference, not just on your egg health, but you can have a difference on your own health. And then the other thing is that it's going to happen overnight. And some people think that medical fertility treatments are quick. There's a place for them and they're a miracle. I have no problem with them. I just don't think every person is going to need it as their first step. But some people will go to it because they're in a hurry. But it takes a while to do a medical fertility cycle as well. So either in conjunction, doing these things in preparation for it, or just knowing both are going to take time. Don't choose one over the other because of a time crunch. Choose what speaks to you the most and is going to be the healthiest choice for you. So I think that's a big myth is they're going to call their doctor next week. They're going to be getting a retrieval. It actually takes a lot more time than that. It takes months.
What advice, if any, would you give to a couple who is struggling to conceive?
Well, I would probably ask them 20 different questions. Yes. But what advice I would give is just to ask a lot of questions. Don't feel afraid to seek information and knowledge. Where to start if they've been trying for a year and they haven't gotten pregnant is testing is always a good thing. Knowing why gives you a lot more power and save you a lot of time by knowing what direction you can go. And when it comes to men, please get tested. Your test is the easiest fertility test that will be done. All of the female fertility tests most of them can be painful. So don't feel bad about it. Don't feel like it's wrong that you have to go get a sperm test. Just do it. It's so easy compared to an HSG or laparoscopy or any of these other possible procedures or tests that might happen for the woman. So both can get tested and both can participate through diet, through lifestyle changes, through herbs, and both make a big difference because it's 50-50 with the DNA and the materials needed to make a healthy baby. And also it's the same ratio of fertility issues lie within the male just as much as with the female.
And what would you say is the biggest myth about fertility that you would like to see corrected or that just irks you in general?
Well, I guess this is from my point of view as an internist who takes care of people with PCOS and finds them failing fertility treatment or doing things they can't afford. It really irks me that fertility specialists are so narrowly focused on drugs and that they seem to not be interested in the big picture and that it's so much more than fertility drugs.
So for women who are listening to the podcast and maybe struggling with infertility, what advice, if any, would you give to them?
The first advice I would give is to get some more opinions, because I find that people often get very locked into a diagnosis that is, difficult or, are on the treadmill of fertility treatments without really understanding why and how they can support themselves better. to take a step back and ask for help, through a naturopath or an acupuncturist even, because there's so much we can do to support this journey, and getting you, having a more active and proactive role in the fertility process will help tremendously as well. So that would be number one. And number two is to not forget how essential, nutrition, exercise, and basic self-care are in the fertility journey, no matter where you are at in it. I see amazing things every day with just improving people's diets. And, a lot of the time I feel like I'm a common sense medicine doctor, because a lot of what I tell people to do is, drink water, have less caffeine, keep their alcohol moderate, eat their vegetables. But those things do make a phenomenal difference. And if we can get to a little bit more fine tuning in terms of identifying food intolerances or, lowering inflammation, it's extremely powerful. And the last thing is that there are often alternatives to medications in the, natural supplement world. So it's not always necessary to take a fertility drug that, that scares you with the side effects. There are a lot of things that you can try first before you start going down that road. And most naturopaths are actually very reasonable in terms of timelines. We're not going to keep you, just trying in the dark for a year before it's time to jump onto another path. But there are things to do first in terms of making your body as healthy as possible.
One of the things that you talked about as well in the book, because then you having numerous IVF cycles, you had to learn how to manage that 2-week period where after you've had the egg implanted, how do you actually live your life for those 2 weeks without driving yourself completely insane? And yeah. I loved one of the things you talked about, because it never really occurred to me, but after you said it, it made perfect sense. That fear that the egg might fall out. And kind of managing that.
The biggest one.
So I just love for you to talk about how you work with clients and patients to manage that 2-week wait period after they've had an IVF treatment.
Well, I actually wrote a huge 4,000-word thing all about the 2-week wait. And when I saw my editor, they cut it out. And I'm like, oh my gosh, you have to put it back in the book, because really, this is like the most important time, because women drive themselves crazy, as you know, and as I know, and as anybody listening to this podcast will know. And, how do you manage it, right? Rather than driving yourself crazy. Well, I dispel myths. So the myth is that the egg or sperm can fall out. And so when women are having sex, oftentimes they're like lifting their bums up in the air. Sure, that's nice, but really it actually doesn't do much. And so I need you to visualize that sperm can physically swim. And that's the whole point. Sperm has like these little tails. They look like tadpoles, and it can swim up within a matter of seconds right into the fallopian tube, sit ready, waiting and perched to fertilize the egg that's coming down after ovulation. So you can have sex standing up. You can do IUI and you are able to, get up. You can do IVF and you're able to get up. And then in terms of how much activity, how little activity, that kind of is personal dependent, because if you're a person that is a couch potato to begin with, you certainly don't want to be all of a sudden being so crazy active. And then for a person that is normally active, it's not about just sitting down and, having bed rest for 2 weeks. That doesn't work either. And in fact, there are studies that say that after an IVF, if you have 2 weeks of bed rest, it hinders blood flow. And you don't want that, because when the embryo implants into the uterus, it requires lots of blood flow, lots of volume of blood to keep it going, to keep it embedded. So little light walking is good. Laughter is excellent, because it keeps your uterus nice and relaxed. And the one visual I always get women to think about is, think of a jam sandwich. Your uterus is not like this open vessel. It's literally like a collapsed balloon. But then this collapsed balloon, or what I call a sandwich, it doesn't fill up until a developing baby grows into it. So it grows as the baby grows. So visualize a jam sandwich. Your bread is the uterus, and then the jam is your uterine lining. It's sticky. So even when you move, things should not fall out over the 2 weeks. Is that enough?
That is amazing.
Is that a good closing?
That's fantastic.
Well, and I actually do think, and I take the approach of body-mind medicine, I actually do think it's really helpful to address the more body, pieces of the puzzle first. Is her diet nice and anti-inflammatory? Is she on all the supplements she needs to be on? Is she getting great sleep? How are her circadian rhythms? Is she got structural components that we can address, soft tissue things, strength? Because when a woman feels more vibrant and stronger and healthier in her body, is kind of clear out the brain fog, get her menstrual cycles back so that she's tuned into them. She's like got energy at certain times of the month. She gives herself permission to rest at certain times of the month. These really kind of physical components of general health. Once you do that, it's so much easier to address the more emotional, psychosocial components because if you have to quit your job, or if you have to have a difficult conversation with your husband, or if you have to change the way you parent or the way you receive help, or, some of these bigger issues to really get to the root cause of your health problem, it's a lot easier to do that if you feel strong in your body and safe in your body. Mm-hmm. And so, it's easier to say, okay, yep. I need to get a different kind of job, or I need to go to bed earlier. I need to exert, my opinion. I need to speak my opinion more commonly here. If you feel safe and strong in your body, it's just so much easier to have those kind of challenging psychosocial conversations and experiences, and even to plan those without getting really afraid or fearful of them.
What would you say is the biggest myth about fertility that you would like to see corrected?
I would say that, well, honestly, I think the biggest myth about fertility, I don't know if this is exactly a myth, but that we don't, from the beginning, look at both male and female fertility. If you're in a couple and you're struggling with infertility, about a third of the time there's a female physical related issue. About a third of the time there's a male physically related issue. And then the third of the time we don't really know. Whereas fertility seems to be kind of the job of the woman. It's really, your partner, your male partner, the male partner involved has to take the same level of kind of curiosity and commitment because fertility is not a woman's issue. It's a human issue.
Well, and final question of the day. So for, anyone listening who is, struggling to conceive or on their own fertility/infertility journey, what advice, if any, would you have for them?
Find some good friends who really will be able to walk with you through the process. That might be a new friend. It might be a support group of some kind. There is something so profound when you find somebody else who is going through the same thing, particularly with this journey, which can be just so isolating, is find somebody else who gets it. They may not even have gone through it, but they get it because they're empathetic people. And find those people and journey with them for a little bit, just to have that soul buddy that is alongside you and to walk along with you.
All right. Well, thank you so much for being part of my final episode, my episode 100. I had a ton of fun putting this together for you. It was actually just so much fun going through and looking at all the interviews and thinking back to all the different guests that I've spoken to, and thinking about all the different people that have reached out to me, the group that I formed, the Fertility Friday Facebook group. If you would like to be part of the Facebook community, head over to fertilityfriday.com/community. There's a bunch of women in there and we talk about different episodes. A lot of women will ask questions about their charts and things like that, and often support each other. And I love to see that. I love to see the members of the group supporting each other. So yeah, it's a crazy, fantastic, wonderful, busy journey that I've been on for the past 100 episodes, and it's an interesting time for me to reflect on how different things are now than when I started, just in terms of When I first started, I've said this on the podcast before, it was just me and my microphone in my basement, and I didn't know if anyone was listening, and I didn't know if anyone would care what I had to say. And since starting this podcast, I've just been so honored and just in awe at the responses that I've received. And it's really reiterated for me how important this knowledge and information is for women, and how little information is available, specifically with respect to our reproductive cycles. And what I talk about is not magical. I mean, it's important, and it's just a tragedy that it's not readily available. So I'm happy to be doing my part and trying to get the word out. I'm happy to see that my listenership has grown. I'm happy to see that it's been, having a positive impact in the world. I'm really happy to see the community that's forming. I'm so just thrilled to be able to be working with members of my community, and it's a really just an amazing blessing that this podcast has been. And so I am really happy to share this 100th episode with all of you. I would love to hear your feedback and your comments. So make sure to go over to fertilityfriday.com/100 and leave a comment. Let me know what you think about this episode and if you enjoyed it, and if the podcast has touched you in any way. I would just be honored if you left a review on iTunes to share that with the world, so that more people can find the show and more people can see how it's been impacting them. And of course, if you do have ideas for podcast episodes, guest suggestions, I definitely have a list. I keep them all in a folder, and whenever I'm thinking of what to do for my next episodes, or who to reach out to, I go in there. So make sure to send me an email at info@fertilityfriday.com. I have some really interesting and exciting ideas for episodes coming up in the future, so I'm really excited to share that with you. And I just want to thank you for hanging out with me today. As always, I do appreciate all of you for taking the time to tune in to the podcast, and I appreciate all of you for being here and for supporting the show over this almost 2-year period. So it's been a great ride. I've been really enjoying it, and I'm really excited to keep just sharing knowledge and information around fertility awareness and fertility and women's health in general. Before we end the show today, I'd like to take a moment to thank my sponsor. Today's episode is sponsored by Green Pasture Products. They offer fermented cod liver oil, concentrated butter oil, coconut oil, and a variety of products and blends. One of my favorite products that they offer is fermented cod liver oil, and it's one of the few food-based supplements that I always have in my house. And not only do I take it, but my kids take it too. The fermentation process preserves the natural vitamins A and D, which your body needs to make hormones. And in episode 9 of the podcast, I interview Sally Fallon-Morell, who is the founder of the Weston Price Foundation. And in that episode, she talks in detail about the benefits of vitamins A, D, and K. So make sure to go back and have a listen to that episode, and also head over to greenpasture.org for more information about the products. So thank you so much. And as always, until next time, be well and happy charting.